Okay, I'm going to be hanging a primary bag, and I'm going to start by checking my doctor's orders for the correct dose, route, and frequency. And I'm also going to check my patient's labs and his allergies. The doctor's ordered Rocephin, which is an antibiotic that binds to bacterial wall cell membrane, causing cell death. It's used for infection. The safe dose is 2 grams every 12 hours. The side effects are seizures, pseudomembranous colitis, diarrhea, and the contraindications are hypersensitivity to penicillins, cephalosporins, and history of GI disease. While on this medication, I would watch for superinfection and watch for phlebitis at the injection shot site. The infusion time will be over 30 minutes, and here's my equation. It's 2 grams every 12 hours. 1 gram equals 5 milliliters, so 2 grams would be 10 milliliters added to 60 milliliters over 30 minutes. And I would tell my machine it's 120 milliliters over 60 minutes. Alright, now I'm going to use my asepsis technique to draw out my Rocephin. And I'm going to clean my bottle and draw it. Alright. And now I'm going to inject it into my medicine bag. And I'm going to label my bag and with the patient's name, dose, route, and frequency, and initial it. Now I'm going to spike my bag, and I would label my tubing with the date, time, and initial it. Now I'm going to make sure that my lines are clamped and set my line by squeezing the drip chamber, and then I would have my 10 milliliter syringe filled with 6 milliliters of normal saline. Now I'm going to wash my hands and glove up, and then walk into my patient's room and ask him his name and date of birth and if he's allergic to anything. And then I would tell them that they're about to receive Rocephin, which is an antibiotic. Now I'm going to check my patient's IV site for infiltration or phlebitis, and everything looks alright. Now I'm going to clean my port and get a blood return, and then I would flush my line using the push stop method with 3 milliliters of normal saline. Alright, then I would clamp it, and now I am going to hook my patient up to the IV line. I'm going to set my flow rate. Alright, and that looks good. And I'm going to open my lines up, and then I would wash my hands and take off my gloves. So now when the infusion's complete, I would periodically watch for phlebitis and infiltration at the site. Heparin would only be administered if it was ordered by the doctor, and then I would attach a new alligator clamp to my line, and I would flush it with 3 milliliters of normal saline with the push stop method. I would dispose of all my items in the correct containers, and then I would document the time, drug, dose, route, condition of site, the volume of fluid used to deliver the medication into my Minibag.